Hello. The title of this presentation is Identifying Perceptions, Opinions, and Beliefs of the Community Towards Chronic Health Conditions. Focus group discussion around communities' health issues. The prevalence of chronic medical conditions are associated to multiple risk factors such as aging of the population, unhealthy habits, and social determinants of health, SDH. The vulnerabilities in Puerto Rico regarding chronic health conditions have been reported as important health disparities associated to governmental budget cuts in education, healthcare system, and other SDH such as living under poverty conditions. This study is a part of a larger project aimed at identifying perceptions, opinions, and beliefs of the community in regards to chronic health conditions among disadvantaged communities. This qualitative study, framed on a community-based participatory research approach, developed 6 focus groups with 59 low-income adults from the southern region of Puerto Rico. Groups were conducted in person or remotely using the Zoom platform during the 2020 and 2021 year. The objectives were addressed using 8 open-ended questions developed in collaboration with our Scientific Community Advisory Committee. The committee also collaborated in the recruitment process and results interpretation. The focus groups discussion were recorded, transcribed, and analyzed with a content analysis computer program, which is called ATLAS-TI. From this analysis, we developed 4 main dimension topics, which are knowledge, vulnerability, barriers, and resources. And for the purpose of this presentation, we selected the most grounded topics from the discussions, which are mental health, individual vulnerabilities, economic barriers, and community resources. These are 4 fragments from different participants in different groups, and we selected them as a sample for representing the dimensions. The participation of the community members across all phases of the study will help guide tailor-made intervention models that prioritize their identified needs and evaluate their available resources to reduce risk factors associated to chronic health conditions. This approach will facilitate future interventions that are potentially sustainable and respond to the community needs. Also, integrating remote technologies into community research have proved to be an useful asset for hard-to-reach participants. Our next step will be to complete the quantitative phase of the assessment of the risk factors associated with chronic medical conditions among disadvantaged communities. Well, that will be it for this presentation. Thank you for your attention.